wait. I can stop at any time, okay?
Okay. Okay, well, my phone, which I think is the most reliable timepiece, my phone tells me it's 3 o'clock Eastern time. My computer tells me it's 2:59, but I think that's close enough for government work. So let's get started. I am thrilled to introduce to you Johnny Ross, who is going to talk about the Mind Notify product. I'm not sure how many of you, sorry, I didn't turn off my phone. Not sure how many of you have alerting or fall preventing systems in your demo or loan program. But if you have or have been thinking of doing so, this might be a good introduction for you. So without further ado, just a little bit of housekeeping, and that is, please keep yourself on mute unless you want to ask a question. And Johnny, I don't know how you want to handle the questions. Do you want to, in between some slides, stop and see if there's questions? That's up to you.
That's fine. Whatever works easiest. Will you let me know when a question pops up, or?
Yeah, if people
Okay.
put it in the chat window, I will let you know.
Yeah, I am very comfortable stopping on any slide. So I'll try to, as I go through a couple, see if there's, and just ask if there's questions. But if I don't, please ask away. It's probably better to interrupt during the presentation so it's fresh on the slide there, okay?
Okay, and just one more thing to attendees. I will be sending out a very short evaluation. Please complete it. You all know the importance of evaluating our work. So without further ado, Mr. Ross.
Great. Well, thank you very much, Amy. It's my pleasure working with you, and thank you so much for helping to organize this conference call. I'm excited to work with each of you. Just a little bit about Medhab. That's the name of my company. We try to specialize in remote wearable technology. Just so you know, we have what's called a footbed. Think of a Dr. Scholl's insole. It's a class 2 medical device that we're about to launch for physical therapy. We have augmented that device and put different technology in it so it could work much more quickly in milliseconds. And we have created a device called RPM Square for sports performance, for running. Basically, it does remote gait analysis, running gait analysis, looks at symmetry in the legs. And we actually worked with Michael Johnson. Some of you may remember him from the Olympics. He's now a global trainer of athletics. He helped us to understand what we needed to measure. In regard to the StepRight product for physical therapy, it's one where the physical therapist can augment, or create, I should say, and customize physical therapy protocols for leg injuries. And the patient is able to do their exercises in home or in the clinic. All the data is streamed through a HIPAA-secured network to the physical therapist. And the product that we're going to talk about today is called My Notify, and it is a brand new entry to the market. I say brand new, it's been out for about 6 months, but we're gaining traction everywhere. And I learned of your organization through a gentleman named Joseph Lugo at the Centers for Integration at the federal level. So he kind of linked us. So that's what we want to talk about today. There's the name of the product, My Notify. We called it My Notify because it offers different notifications to the user and to the family. And the big thing about My Notify, as you'll see here momentarily, is that today, if you look at 100% of the fall detection products, most of which don't have fall detection, it's just a button to push, but 100% rely on a call center. Those are very expensive. Our seniors actually loathe call centers. They don't want to talk to strangers, and they can't, quite frankly, afford the monthly fees. This is where My Notify comes involved because it communicates directly with family members. Therefore, there are no monthly fees. So it's loved ones who are coming to support mom and dad, if you will. A little bit about myself. I've been in healthcare all of my life. While I was working on my master's degree, I worked for the American Cancer Society as an area director in West Texas, out in El Paso. From there, I went to Johnson & Johnson. I started carrying the bag like everybody else, and worked my way up through management and through contract negotiations with health plans. And from there, I just always have done athletics and stuff in my life. And I had a very complicated knee surgery done, which got me to thinking about remote technology and how we could have technology interact better with patients and or clients. So again, here about My Notify, you can see here the big thing is that it's a one-time cost to clients, no call center, no monthly fees, no contracts. And that's what people are looking for. So, a lot of times we sit here and think about, the troubles with falls. I'm not going to go into every bit of that for you. I know you know a lot of that, but if you look at just a few things, 50% of our 80-year-olds, pardon me, experience a fall annually. And even more profound than that is that one or every 19 minutes, a senior dies from a fall. And what we have found through research is your traditional PERS, your personal emergency response system, not to disparage any, because all products or any products that can be used by seniors have some type of benefits. But the reality is they have not been adopted as readily by seniors because they don't want to be stigmatized as that person, I've fallen, I can't get up. They don't like the bulky pendants. A lot of them don't work outside of the home, but they're starting to. They don't want to push a button because they're afraid, the ambulance will show up, and then they're further stigmatized. So those are some of the things we found in market research, and we built our device, My Notify, to avoid those issues. So, you start thinking about what happens, after the fall, and so you have, obviously the things like, there's a lot of background noise. I'm not really sure why. Just I thought I'd throw that out. I don't know who. But anyway, there's a lot of anxiety. There could be hurt very badly. It could be bleeding. They all of a sudden dehydration. I mean, up to death. I mean, it's a very, very serious situation. And the one I want to talk about here is the anxiety piece of it, because not knowing if somebody's coming to help or not. With My Notify, the user knows, the family knows, and if we can reduce that anxiety, that's a big one. And then as well, when you look at hospitalization, on average, it takes 18 and a half minutes for an ambulance to arrive. Friends and neighbors can get there momentarily. So let me stop there real quick, just a quick check-in before we delve into the product. Are there any questions? Excellent. Please stop me if you need me to. So let's talk a little bit about the benefits of automatic fall detection. So automatic, the way My Notify works, it employs artificial intelligence. And what we have done through an institutional review board at the university, we employed the assistance of the physical therapy school, where the faculty, the PhDs, actually helped to understand and ascertain through the CDC how seniors fall. Believe it or not, there's about 15 or 16 ways that are most common. We then enlisted the help of the PhD students, the nursing department, and even some fraternities, where we literally threw out mats. We built a collection app, and we collected data, and we captured nearly 40,000 fall events, as well as gestured events with the hands, to help this algorithm understand what a fall is and what a fall is not. So that's how it works. To my knowledge, it's the only one that truly works off artificial intelligence this way. It works off of what we call acceleration and jerk. There's a certain speed that happens on a fall, and then there's normally a sudden reversal. That's called a jerk, and that's what we've added to be more accurate. And by the way, our device is 92% accurate detecting a fall. It does not, you don't have to rely on a button to press. Now, there are buttons on the device, yes and no buttons, simply because when the notification goes out, that yes, if a senior falls, for example, that button will it will tell our friends and family, their friends and family, whether or not they're conscious. As well, it can serve as a request for help. So it even works when the user is unconscious in more violent type falls, and I'll explain that a little bit further because there's timers involved that do that. As well, it provides the location of the fall, because for those seniors who have smartphones, and you don't have to have a smartphone with My Notify, but for those who do, it actually knows where the fall is, and it lets the family know. So if the senior's out in a parking lot, you know, going to watch their grandchildren perhaps play soccer or something, and they fall in the parking lot, guess what? The family's going to know where they are. If they pull over on the side of the road going to church, they feel terrible. They pull over, they can get help right away. Their family's going to know where they are. Now, to be clear, the GPS is not turned on the entire time. Seniors were very clear about that. They don't want to be tracked. So it only turns on when it's needed, and then it turns back off. There's two good reasons for that. One, the best reason is seniors just don't want it. And number two, if we left GPS on the entire time, you'd have to carry a car battery around just to make it work, because the drain on the battery would be so great. So the device wakes up in milliseconds and it goes back to sleep in milliseconds. That's how fast it works. So, you know, we start thinking about who needs automatic fall detection. Obviously, you know your clientele, you know, better than I. I suspect many of your clientele would qualify or be in need for fall detection. But we get quite a bit of business from people who have chronic conditions like stroke, Parkinson's, and diabetes. Of course, those as well who have had major, you know, limb or back surgeries as well, because they're more prone to fall. But I'll tell you one that I think about a lot that is a staggering statistic. If you think of women in America, okay, 50% of women who are 65 years old live at home alone because their spouse has already passed in most cases. As that number ratchets up to 70 years old, that number approaches 80% very quickly. And, you know, you think of a 65-year-old woman, or man for that matter, may or may not necessarily be at great risk of falling. But again, you never know because there's no symptoms. You fall. And so, you know, I think of that person a lot. You know, my mother lived at home for quite a while. And I think of her a lot, you know, when we developed this, that you have women that are at home alone, at least they have a device, any type of device, to be safe. And that's probably good for anybody to take that type of advice. I want to show you a couple of links here. Just this right here is a TV commercial that we're going to start running in January. Oh, let me see, I mistyped it. Okay. And this is a little bit over 2-minute commercial, but this will tell you very eloquently what we're doing.
Are you or someone you love at risk for a fall? Now, there's My Notify, the breakthrough fall detection technology that notifies family, friends, and neighbors automatically if you fall or need assistance.
Do you want to send a message to your emergency chat?
The medical evidence one in 4 seniors will have a fall, and everything with the safety on more secure.
Most alert systems you have to pay month after month after month, but with My Notify, it's just one easy payment.
With My Notify, there are no faraway call centers, no speaking with an unknown operator, no waiting for emergency response, and best of all, no monthly fees, ever.
Just one payment. one time.
My Notify can accurately detect a fall and precise GPS location and can distinguish it from any other sudden movement. And if there's a fall, My Notify immediately sends an alert to your network of family, friends, and neighbors, and it notifies them even if you are unable to respond.
My Notify means being a good friend and neighbor.
My Notify gives us all peace of mind.
Other alert systems can cost over $49 every month. That's $588 a year and more than $2,500 over 5 years. Not My Notify. It's just one easy payment and help can be on the way.
We're right next door.
We're on our way. Of all the fall detection devices out on the market, I prefer My Notify for a few reasons. One, it's affordable. There are no monthly fees. Two, you get to pick who's on the notification list in case of an emergency. And third, there's an app built into My Notify to help keep you healthy, balanced, and coordinated to avoid the fall in the first place.
Call now or go online to order your My Notify. Use promo code TV18 and get a $50 discount off our regular price of $335. That's only $285 with no monthly fees ever. If you don't have a smartphone, no problem. The new My Notify Hub will keep you safe in your home. And if you order one for your spouse, you get a $100 discount on your second My Notify. So call now. For just one price and no monthly fees ever, you can stay safe, stay fit, and stay notified.
With My Notify, Dad can remain safe and secure in his own home.
Notify, 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 My Notify.
There we go. So, oh, I lost my PowerPoint again. Let me pull that, but I don't understand why it does that. There it is. Okay, so before I go on, just so you know, that is our, like I said, retail commercial that we plan to launch nationally after the new year. So it tells you quite a bit. So before I show the other two clips, which are just a few seconds at a time, are there any questions now? So this should give you a really good picture of what My Notify is and how it works, why it's unique to the market. Excellent. I'll keep going. So what I want to show you next is this little slide. One of the things that we have built in to My Notify, and just the reason, just as an FYI, all of my staff, including myself, come from the medical world. And so when we built My Notify, you know, we talked to many seniors and we built it with a medical bend to it, even though it's a retail product. So the good thing is in doing so, it is a Class 1 exempt device regulated by the FDA. It meets all FCC standards, not only in the US, but Canada and in Europe as well. And it is completely HIPAA secured. So notifications that are going to friends and family are all safe in our secured cloud, HIPAA secured server. So one of the things we did, because it's really important that we can catch the fall and get help more quickly, because the faster that can happen, the less likely that, you know, if they do have to go to the hospital, the less likely that they have to stay in there much longer or succumb in the hospital. You know, we hear the stories about people lying there for 12 or 24 or 36 hours. That is impossible with My Notify because the way it's engineered. And I'll explain that momentarily. In addition to that, though, from a clinical standpoint, we have included 38 different range of motion and strengthening exercises for the legs and the arms that users of the device can perform if they choose. They don't have to do it, but they're there for them. And if they do these exercises, you know, they're obviously going to be stronger and more range of motion, which is a straight linear line, which can mitigate, you know, the propensity to fall. The way it works is the exercises are performed. They are tracked in range of motion, degrees of motion, and in repetitions. So the family and the user of the device, a lot of times it may be the spouse or the oldest child, can look at this data with the user, mom or dad, whoever it might be, and would be able to see on a straight line graph if those exercises are, if they're maintaining or if they're even doing them. And if not, those could lead to good, productive family discussions, because if degradation starts to occur, we have to be concerned about little things like slippers that they're wearing, small pets, rugs, electrical cords, anything like that that become a hazard for falls. These are productive things that we can talk about, we meaning family, with our loved ones. So here's a sample of a My Notify exercise that can be performed utilizing the device. It's very simple. You'll see the range of motion and the degrees counting here as the young man, who's one of my developer, performs this simple exercise. Oh, what's going on here? Why is it not letting me do that? Let me try that again. Well, that's odd. I don't know why it's not letting me perform that. Let's give it one more try here and see what's up. Maybe a connection issue here. Okay, well, let me click back on the screen. Obviously, this one's not going to behave today for some reason. But what you'll see here, I can show you based on this movement. So he's actually just looking at his cell phone, and it's a 10 or 15-second video. He's utilizing the left arm, and it's just going from stretched out forward to the side, forward to the side. That's what he's performing. And as he's performing that, you would see the rep counter counting. And then over here, you would see the degrees of motion. From here to here is roughly a 90 degrees, and he would be achieving relatively close to that. My apologies, I'm not really sure why it's not working right now, but we will send this to you and you can see this yourself, okay? So let me go ahead and click back out of this, and let's see if we have difficulties on this one. This one here, if it works, is simply explaining a fall. Okay, I am perplexed. I don't really know why, Amy, this is going on right now.
That's okay. Obviously, you've got some gremlins, but we can send out the links.
Yeah, thank you. Well, what this would show you, and my apologies, I don't know why. I mean, this is just tested moment. It has to be the connection here, not getting to YouTube fast enough to make the connection. But I'm going to go back to this just so you can see the picture, because I can certainly explain it again. So in this picture here, he simply falls to the ground, and you can see this in a matter of, a split second. Once he hits the ground, the device is already waking up before he hits the ground, because it wakes up in a millisecond, right? So in 1/1000th of a second, it already understands this and starts to calculate. And by the time he hits the ground and just lies there, not even for a second, it already knows. And in this case here, the phone is showing you, and it verbalizes, My Notify detected a fall. Did you fall? At the same time, his wrist device is vibrating, pulse vibrating. So those that have a smartphone obviously would hear and see this, but if you don't, that's okay, because the device itself will vibrate. If he is conscious, he would be able to push the red button. That's just telling everybody, yes, he fell and he is awake, okay? If it was a more violent fall, he would not be able to do so, and the device would understand to send a escalated notification because of that situation. And I'll explain a little bit further momentarily. So here's the beauty about My Notify. Again, it's not a pendant, which seniors do not want to wear. They're embarrassed. It can be worn on the waistline, on the bra, shirt pocket, like on the chest shirt pocket, or worn on either wrist. And we at first, it was really just the wrist. Then we tested the belt. We had lots of women call and say, can we wear it on the bra so when we go out, nobody even sees it? Of course, we can't just say yes and do it. We have to test it and submit all the FDA documentation. So that's what we have done. And while we were testing it, obviously it works from the shirt pocket the same way. So a man or a woman could put the device in their shirt pocket and nobody would even know that they have it on. And that's the beauty of it. So I'm going to go over right here with the second bullet, because we already talked about how it's worn. And it's in fact, it's the only device that can be worn in multiple locations like that very discreetly. So here's what happens. Let's say a person falls. As soon as they fall, it calculates, and then it pulse vibrates on the wrist. If they have a smartphone, their smartphone will talk to them. And they have the option, if they can, to push the red button. What happens if they push the red button? It immediately sends the notification to their selected family of caregivers, and all of us would get the same information. It could be as many people as they want on that call list. We would all get, in this case, a notification that reads, my notify precaution. My notify detected a fall. User indicated, that they fell. So why that's important is now that we know at the time of that event, as a family member or a caregiver, when mom or dad fell, that they were conscious. Because right away we could start picking up the phone because we want to relieve that anxiety. Hey, mom, dad, we're on the way. So let's just say it was myself and 15 other people on this notification for my mother, let's just say. And once I receive that, I could be wherever I am. I could look at that. I can read it. I could click on the Google Map locator. I know where she is in her home or at the park or wherever. I can then, in that same HIPAA secured notification window, I can either verbalize or type in there and say, hey guys, I am on my way. I'm 10 minutes from mom. I'll let you know. Now, everybody knows that that message went out, including my mother, because her device will vibrate again, letting her know that we've responded and we're on the way. Now, again, like I said, in the event of a fall that's more violent and she's unconscious, that's okay. What'll happen is it'll wait for her response for exactly 1 minute. If she is unable to respond at that point in time, it sends an escalated message, which is a my notify warning. This time it tells us a fall occurred, but she was not able to respond. And it still has the Google Map locator, and I can still take the same actions, okay? Now, it's not only about the fall. Sometimes it could be a situation where mom or dad is not feeling well. Something as minor as the flu to something as serious as, some cardiac problem, right? It's okay because it's, all they have to do is push the little red button, and the device will pulse vibrate, letting them know that the signal was sent, and we all get a request for help. And the notification is called a request for help. We'll see it. We will know from that mom or dad needs help. So again, the first one to respond, calling mom or dad in this case, all of us would know, and then we could follow back up at any time and say, hey guys, mom is okay, or dad is okay, or I'm on my way. I get there, I can assess the situation, I can get back right on that same, what's called a thread, and I can go right back on and say, hey, I just checked mom out, she needs to go to the hospital, I'm taking her now, I'll let you know. All of that, it's right there for the entire family to take action to help mom, if that makes sense. Let me stop again to see if there are any questions.
I don't see any in the chat window yet, Johnny.
Okay, well, good. Hopefully that means I'm thorough. All right, here we go. So, like I said, we have the app and we have the hub on the right. So, we know that not all seniors have smartphones. And so we developed this My Notify hub, which allows them to simply connect it with an Ethernet cord to their in-home computer service, internet, and they plug it in, they push a little green button on the hub, and it lights up to connect, push another green button, the device lights up and connects, and now we know, and they know they're connected. That simple. And so that would be the mediator while they're in their home. And that device, there's a chip in the hub, and it has a range of about 350 feet. So it would work, not only in their home, but, out if they go out to check the mail or if they're in the backyard, they should still be connected. Again, unless they have a large piece of property. Now, here's the beauty of it. Everybody receives the hub, whether or not they have, whether they have a smartphone or not. Because even those seniors who have a smartphone, they don't like to really have the smartphone right there with them all the time in the home. They like to put it somewhere, leave it alone until they need it. Great. That's okay. While they're in the home, the hub will be their mediator. If they decide to go, let's say to church, lunch, whatever they need to do, and they leave and walk around the park and they pick up their smartphone, as soon as it disconnects from the hub, it'll automatically connect to their phone once it's paired for the first time. When they return home, it'll disconnect and revert back to the hub. So like I said, those with smartphones, they are completely remote wherever they want to go, whenever they want to go. With the hub only users, meaning that they don't own a smartphone, then they are relegated to basically their property and relatively right there close to it, which is not uncommon. So if you could take a look here on this picture, you can see how small the device is. The actual device is in a black box, but for easier to see, we put it in here so you can see that. So it's very small. It is about 1.5 inches long, 1 inch and maybe 1/4 tall, and about not even 1/2 inch thick. So it's smaller than the old beepers that we used to have. They get their choice of black, brown, or charcoal when it's ordered. And of course, we have these colors right now available. They can choose whatever color, and they can actually purchase different ones if they want for different outfits. That's completely up to them. But as a reminder, though, these are the big things. There's no monthly fees, no call centers, no equipment installation, no contracts. It's just a one-time payment and done. And most important, maybe, very discreet. You can wear it and most people would never know it's even on. So just to kind of give you a little, some screenshots for those who have an app. You saw this on the video that obviously didn't work, but you'll see it when we send this to you. This is what happens when the phone wakes up. That screen will wake up right there and say, my Notify detected a fall. Did you fall? Boom, just like that. And if they have an Android phone, that speaker turns red. They can actually say yes or no to the phone from on the ground. If they're on the ground and the phone's up on the counter, it'll hear them say yes or no.
So Johnny, we have a few comments and questions.
Excellent. Okay.
So one, and you might have just covered this, is whether it can work with an iPad or other tablet versus a smartphone.
Yes, it'll work with any smart device, iPad, iPhone, Android tablet, Android phone.
Excellent, excellent. Another question was the extent to which it's waterproof.
It is waterproof. We have certification, so it can be submerged in a bath or, you can't go deep sea diving with it, but you can certainly submerge it in water. It's completely waterproof.
So you could shower with it?
Shower or bath. Yes, ma'am. We did that intentionally because, you think about it, that's probably the most vulnerable place is in on a wet tile floor, or literally floor in a bathroom.
Yeah. Another question is the distance range that the phone can be from My Notify.
The phone and the My Notify, it's called Bluetooth Low Energy in the phone and Bluetooth Low Energy in the device itself. In a straight line, unabated, that distance on Bluetooth standards is 30 meters or about, let's say, 90 to 100 feet. In the home with walls and all, that is slightly diminished, but in most cases still covers the entire home. The hub, we have actually had the ability to add a bigger antenna, external antenna on the hub, and therefore we get 350 feet of connection.
Okay, and the last question I see here in the chat is how long does the charge last?
These are all excellent questions. The charge lasts from 50 to 72 hours. And the reason for the range is dependent on where it is worn. So if you think about it, if it's worn on the waistline, a chest pocket, or bra, basically the torso, there's not much movement there. It's the most stable part of the body. The device doesn't have to calculate random movements. Whereas when it's worn on the hand, we're always moving our hands, it has to calculate more. So 50 to 72 hours on the charge, and it takes 2 hours to charge from a completely dead battery to a completely full battery.
Great. And that's it for the questions for right now. So if
Okay.
you want to proceed.
Yes, and you know, before I do, this spurred a few things, this question, so thank you for asking those. But it spurred a couple things that I want to go back on, because I've talked to you a lot about what the, you know, how the family can interact in the case of a fall or a request for help, right? So if you think about the call centers, you may or may not know this, but call centers, part of their service is they routinely call the customer and they'll say, oh, well, Mrs. Ross, this is so-and-so call center. Are you wearing your My Notify, your life alert device? We'll say, oh yeah, great. Is it fully charged? Yes. Is it connected? Yes. They have no idea of knowing that. And I don't mean that in a negative way. I'm just stating the fact, right? My Notify doesn't require that because it knows. So here's how the family can stay connected to mom and dad, knowing if it's connected, being worn, or the level of battery. I'm going to start with battery. When the battery charge it has only 20% remaining, the device will pulse vibrate once a minute, letting the user of the device, mom or dad, know to take it off and put it on the charger, which we supply. They just set it on there and it'll charge. If they forget to charge it for some reason, at 10% remaining battery, it sends the family a notification letting us know to help mom or dad make sure that the device is charged. Okay? So it's a kind of a checks and balance. Now, there may be times that they want to take the device off, and they should be able to do that. If they're going to church or they're going to lunch or, you know, dinner, movies, whatever, and they're with other people, they don't have to wear the device. They can take it off. There's no problem. However, if they forget to take it off, the device has a timer, and it only waits for 3 hours in this case. And at the 3-hour mark, it will inform family members that the device has been disconnected for 3 hours. That way we can at least just call and see how mom's doing and find out why it's disconnected, okay? Because she could leave and forget, and all of a sudden, you know, the battery goes dead. All kinds of things can happen, but that's why those are in there. Maybe more importantly, we also have what's called an idle timer in there. So let's just say they take the device off to go in the shower, which they don't have to, but they may. Or maybe they take it off in the evening. They don't want to sleep with it, which we recommend sleeping in it as well. But, you know, we know people are going to take it off. So if they forget to put it back on, that's okay, because it's going to notify the family in a 3-hour time period that the device is idle. It is sensing if there's any movement or not, okay? Because it could be something as simple as they took the device off to charge it and forgot to put it back on. Maybe they took it off, you know, like I said, for bedtime and didn't put it back on. They just forgot. These things happen. But it could also mean something else. Maybe it's that they laid down because they're not feeling well and then passed out. Or maybe something worse. But remember, I made the comment earlier that it is impossible to find your loved one on the ground after 10 or 12 or 24 hours. This is why. The longest anybody could potentially need help is that 3-hour period on a disconnection or an idle timer. That's it. And you might ask, how did we come up with the 3-hour? Seniors told us when they leave the house, a good 3-hour period would be a nice round number for them to have to turn it off and not put it back on or be disconnected, whatever the case may be. Okay. So with that said, are there any other questions before I proceed? There's only a few more slides and we'll be done.
Yes, there are. I think this was answered, but does it work with Android phones?
Yes, ma'am. Smart Apple phones, iOS, and Android.
Okay. Another question. Can a family member be notified from more than one device? Let's say there are 2 parents, and maybe one is at home and one is out at a community center. So is that possible to get dual notifications?
The way that would, it's a great question. The way that would work, let's just say if both, mom and dad have a device, they would both have to have a device, obviously. And if dad is at the senior center and mom is at home, that's okay. Doesn't matter where they are, because they would be linked to their loved ones, family caregivers, through an app that the family would download, and they just connect to it. Matter of fact, one of our first sets of people that use it were 4 ladies. They each have a device, and they each connect to each other so that they know that they're safe. All of them live at home alone.
Okay.
Does that answer the question?
Michelle, if that doesn't answer it, please clarify. Another question from Kim. Has this ever been tested or used as a seizure notification device?
No, ma'am. We have not gone to that point yet.
Okay, thank you. So Michelle's follow-up question is, so in the case that there are 2 parents connected, will the family member be able to understand which person the notification is from?
Yes, absolutely. And let me see something. I may have a slide that shows that. There you go, right there. So if I am a, let's say this would be me, let's say in the black, that would be any response that I give. This could be my mom. This could be my dad. I could have multiple people here. We've done that for that reason, because assisted living centers, they have a nurse's station. They would be connected to maybe 20 or 30 or 40 people or more. They would know who is requesting help, because the tone would come in, they would know it, and they would even know if other family members are reacting.
Okay, so in your example that's on the screen now, if this came in to me as a family member, I would know that demo_user at medhab.com is mom, and I can't even read it. Mouse at medhab.com is dad.
Yeah. Whatever you would type in, whatever authentication, they would use, it could be, Johnny Ross or Madeline Ross or whoever the case, and it would have that on there. So you would know exactly who it came from.
Great. A couple of other questions.
Sure.
Does it send text notifications or email notifications, or you choose, or both?
Okay, great. No, it's a textual notification. The way it works is, like I said, it's all HIPAA secured. So when a notification is sent, you read it, you can see it, okay? And it goes simultaneously to everybody in the family of caregivers, I should say.
Okay, but I think the question was via text message or via email.
Okay, the way it works is the caregivers they would download an app to their smartphone, okay? And so it would be linked, the authentication process, when the user registers online, it is linked to the caregiver's email address associated with their phone, okay? So like mine is johnny.ross@hotmail.com. So if my mom wanted me on that list, we would authenticate that. And so by virtue of the app understands that, and it sends it through the secured network directly to the phone as a notification. But it is the reason why we did it that way, which is important. We could have just done a simple text message, right? Just like normal text, but we couldn't override the tone. Plus, every time somebody responds to that initial text, a cost goes out. And so we would have to pass that cost on. So we developed this system here that is HIPAA secured, and it's our own system, and we don't have any cost to pass on.
Great, thanks.
Yes, ma'am.
Another question, is the hub an additional cost?
No, it's part of the device.
Great, and that is the questions for now.
Okay, so those are great. We covered these little slides I was going to show you. I will show you this. For those who have a smart device, they could actually put the phone, in any pocket on their person and go for a walk, and it will count their steps taken and steps per minute, and it tracks it over time as it does the exercises built into the device itself. Walking, as you know, is very important into keeping our mobility and mitigating falls. So before we go into our work together and how this works, any last questions on the technology? Okay, we'll continue. We're on the very downhill side of this now. So, program implementation, we will help you and your staff with product demonstration and marketing collateral to your staff. We'll provide, we have a loved ones brochure and a product brochure that you could, leave behind with the loaner device, and therefore they could speak with their family about it. We have an 800 number there that will help, after we train your staff, so they understand the device and how to help a person set it up and utilize it. We still have product support for your staff when they're talking to that potential client. Obviously, we're going to have special products for pricing for loaners and for your qualified clients. Delivery and fulfillment, that is, I can go different ways on this, and maybe different programs see it differently. The device can be delivered potentially directly to the program, and the program can deliver it, if that's what you want to do, or it's delivered directly to the qualified client using the device, and that's fine. We'll help them with the setup online. It doesn't matter how we do it to us, whatever is easiest for you. Okay. And then invoicing and payment, I don't know if we've come to exactly how that would work yet, because I believe, Amy, it could be different for different programs. So, it could be purchased online. We could set it up that way. It could be invoiced. We have latitude to do and make it work best for the programs.
Yeah, so a question is, and what is the cost?
We are getting there. All right. So there we go. So right now, just so you know, online, our product that sells to an individual is $335. Now, we are going to lower that price because we're gaining ground, and as we gain ground, we gain economies and efficiencies, and we don't have to manage a call center or anything. So as we gain these efficiencies, we can pass those on to customers. So we're actually going to go through a price reduction over the next probably 30 days. Here's what we're doing for the programs, however. Understanding that you need loaner devices, Amy and I kind of talked through this. We thought, okay, if you needed like 1 to 3 devices, we could sell those to you for $165 each. If you need 4 or more, anything above that, we'll lower the price on those loaners to $150. And then when you have qualified persons use your loaners and then they want to purchase one for themselves, we'll have a special code for them, and they can buy it for $175. Think about that. On average, you're going to spend $30 a month minimum on a call center, because that's the only option right now. 100% of the products require that. That's $360 at a minimum cost per year. My Notify is $175 for your qualified customers, one-time payment. Okay. Is there another question?
Yeah. Is it coverable by insurance? Is it considered durable medical equipment?
We are working on that. That's going to take a little bit of time, to get to that point. One of the things we are doing, just so you know, to try to accelerate that is, I mentioned the exercises. We're actually coding in a clinically proven series of exercises called Otago that have been published to mitigate falls by 35%. We are coding that into the device now, and we plan on doing a trial with the University of North Carolina on those exercises with PTs, specifically so we can get coverage from Medicare, Medicaid as far as a DME.
Great.
It'll take a little bit of time, but we're working on it.
Okay. No questions. Oh, wait, here we
Yep.
go. How long will the program and the special public pricing for program clients last?
Well, in my mind, it'll last as long as you're happy with it and it's working for you and your clients, and that it fills a need or a void that's out there. This is a long-term proposition. It's not a, okay, let's do this for 30 days. I mean, you know, it's going to work or it won't, and hopefully it works, and we will keep this going.
Great. And Johnny, you and I spoke previously about the fact that some programs may use this as a loaner. So
Yeah.
what do you think about when the device comes back from being used with a client? What needs to happen at the program to get it ready for the next loan?
Great. Can I table that for about 30 seconds? Because I want to, I'm sure eyes are going below here. If you see the price point here for 1 to 3 is 165, for 4 or more is 150, and to the client, I just changed that with Amy on the phone 2 minutes before the call. I had not had a chance to make the same adjustments here. So if you see, you know, this does not match up there, that is why. This is the price point here that you're looking at, okay? So like I said, this are, you know, with the analytics that we had just came in, and I thought, okay, Amy, let's make this even better for the programs. So yeah, I will change these before I send the deck to you. So going back, pardon me, to your question again was about
when a loaner
yes
unit
okay.
comes back,
Yes.
what does the program need to do, both in terms of any information captured on the device as well
Right.
as the physical device to get it ready for the next loan?
I'll tell you what we will do on that. We, you know, as an FDA regulated product, we have, you know, our standard operating procedures. If something, you know, normally we would not take a device back and, you know, that's been used for months at a time and then try to sell it. We can't do that. However, if we do have returns for some other reason, you know, they bought it for mom and dad, they didn't want to wear it or whatever, we have a standard operating procedure on how we take that back into the office, and just very simple cleaning instructions that we do. I can forward that SOP to you, and it's very simple. I mean, we just basically bring it in. You know, you can take the device and wipe it down with antiseptic wipes, alcohol. It's not going to hurt it. Clean it up really well. You know, if the bands get kind of nasty or whatever, you know, our bands are relatively cheap. I could probably offer something like you know, $3 or $4 for extra bands or whatever. And it might not be a bad idea to have those laying around, but we will share our operating procedure on how to clean them with you.
Great, because as I mentioned, some of the programs may want it, well, even for demonstration, they may want to clean it between it being handled by different people.
That's right.
As well as when it's out for a short-term loan. But
right.
So you've addressed the physical aspect of cleaning. What would need to be done with the software account associated with the device? Not the physical device.
Yeah, on that we would basically electronic cleaning. Yeah, that's not a big problem either. What we would do is each time it is you know, when it goes to a loaner, that loan, you know, they would input their registration, so it's, you know, registered to them on the account, so they can have their family or friends be their caregivers. Once the loaner comes back, you know, we scrub that device with the registration code clean, so then you can reuse that for the next person. So what would have to happen is just simply we would have to know who it went to and their email address. We look it up on our system, and it takes a few minutes, and we scrub it clean, and it's ready to go.
Okay, great, because I'm sure people will need to have such a protocol.
Yeah, right, right. Yeah, that's pretty easy stuff to do.
Okay, I see another question about a user who's using only a hub.
Okay.
How are friends and family invited or connected to the device?
Great question. When a person does not have a smartphone, only using the hub, they simply go online to our My Notify. They register their account, and they can at that point put in as many people as they want to be a caregiver. All they have to do is then call those people and say, hey, probably in advance, I'd like for you to be a caregiver. The person on the other end simply downloads the app, registers, clicks on it, and they'll automatically connect. That's the authentication process for HIPAA security.
Okay, so even if the parent, let's
Yes.
say, does not have a smartphone, the friends and family who are going to be connected do need a smartphone.
Yeah, the friends and family do need a smartphone.
Okay.
Yeah, absolutely. Otherwise, we can't authenticate it, and we wouldn't be able to capture them and notify them wherever they are remotely.
Okay. I think that is all the questions for right now.
Okay. And I think we have maybe one or two more slides, and that's probably about it. Our commitment to the program going back, we'd love to keep this operating as long as it's filling a need and a void for the program. We will always be there at our 800 number for product or training support. If you're talking to a client and about potentially purchasing the device, there may be questions they have. Call our 800 number. We'll answer those questions for you. And, as we make improvements to the firmware or the software, those are just done on a push notification. They're very simple. So as far as a software, which is if they have an app, most phones will automatically upload the software. New software, it's done. It's free of charge. If there's a change to the firmware, like we've maybe made an enhancement to the algorithm or whatever, it's called a push notification on their smartphone. The app will tell them when to do that. They just click a button that says firmware update, and it does it automatically. If they do not have a smartphone, it's done automatically by the device. They don't even have to worry about it.
So we do have a request for clarification on the electronic cleaning.
Yes.
So whenever it's going to go out, comes back from one user and is going to go out to another user on loan,
Mm-hmm.
your company needs to be notified?
Yes, just notify us because we'll scrub that count and basically delete it.
Okay.
And the registration code that is with the device, you will have it, they just have to, the new person would enter that registration, for the next loaner, the same registration code, they just create their own account. When they're done with it, just tell us again who it is. We'll scrub it clean and just repeat the process.
Okay, and is there a certain email that would be used for that?
Probably the easiest thing would be at my support@mynotified.com.
Okay, that's great.
Yeah, and Amy, some of these questions that came up, like the SOP and support for that, you and I can maybe talk offline, and I'll make sure to capture all that and make sure that I have that included with this presentation when I send it out.
That's great. That's great.
Certainly.
So are you about done with your slides, Johnny?
I think so. All we ask in return is just, keep My Notify as an option available when you have clients who may have, some relative, fall propensity. We ask that you educate them according only to our approved brochures because it is a regulated product and we don't want to go off label. That's a big no-no for the FDA. And that's really, we keep it simple and that's what we ask. And there you go.
Okay, well, this has been quite informative, and I think it's piqued a lot of interest as to how this kind of product would work with our demo and loan.
Excellent.
So thank you so much for your time. I will be sending out Johnny's contact information. It will take us a little while to get the captioned recording posted, but we'll let you know when it is posted.
Okay.
And we'll also be sending out the brief satisfaction survey. So thanks everyone for your attendance. Our next demo loan call is next year, January 16th, where we will have Joni Nygaard from Attainment talking about their products. Have a nice afternoon, everyone. And Johnny, I will give you a call tomorrow, okay?
Excellent. Just on close, thank you again, Amy, for organizing this and your efforts to pull this through. Your input was valuable. And for those of you on the call, thank you very much. And I look forward to meeting you in the very near future.
Okay. Bye-bye, everyone.
Bye-bye.